Good afternoon. Good afternoon, everyone. This is Jonathan Otherlight, President of the EHBC. I appreciate everyone coming on the call for today. Today's webcast is really going to be about the EHBC experience, the Employer Healthcare and Benefits Congress, and really what the conference is about. Who's behind the conference, the reach of the conference, and then really what's new for this coming year, the 2014 conference. So it's really a pretty dynamic event for those of you who have been and for those of you who don't, and we're constantly changing and adapting the conference. The conference, we kind of view it as, if you're familiar with the TED events, it's really the TED event for the Employee Benefits Conference. It's not, I think most conferences in the U.S. when it deals with HR and insurance executives, benefits or healthcare, it's very stale, it's very boring, the same old topics, the same conversations, and ours is totally the opposite. It's all about innovation. It's all about what's happening now and what's happening in the next couple of years, and we really bring in the senior leadership. So with that, we'll kind of start rolling with the presentation. So there's a lot of different things that happen at the event. Our tagline for our conference is, feel the energy changes here, because I think our event has a tremendously very strong vibe and energy about learning new things, about collaborating and networking. And there's a lot of different activities going on. There's, I think, 10 different tracks. A lot of different attendees from different parts of the industry, and there's a lot of things going in with breakouts and roundtables that many of you might not be aware of. But we'll be sharing during the webcast some of the roundtables and the private forums, which are some of the neatest part of the event, where you really break out into smaller groups with leaders in the industry and discuss things. And there's a lot of activities going on, within the exhibit hall and other areas. So. Last year we had about over 2,200 attendees for our conference, so it's the biggest employee benefits conference in the country. We're having about 40 to 50% growth every year, so we're shooting for hopefully about 3,000 attendees this year. And it's not just about numbers, it's about bringing in the right attendees, the right high-quality attendees. And we have over 7 conference tracks, and there's over 10,000 networking meetings that happen at the conference. And we have we're going to have about 130 exhibitors this year. So really, I always use this picture. You're tired of the same boring conferences, where people are actually sleeping, or, you have a dead exhibit hall with no energy and no traffic. And, ours is really the opposite. It's packed, packed exhibit hall and packed sessions, and everyone extremely attentive during the sessions. And, what makes our conference successful is really, everyone who's behind the event. So it's the official event of the Healthcare Reform Center and Policy Institute, which is the big influencer and educator across the nation in healthcare reform. It's the official event of the Corporate Health and Wellness Association, which is the largest nonprofit trade association of employers focused on engaging their employees in health and wellness and making meaningful change. It's the official event of the Self-Funding Employer Association, and it's the official event of the Voluntary Benefits Association. So these different associations, the officers, the boards, the members, are what helps organize the event, helps organize the content, the speakers, and which helps promote and drive attendance to the event. And then we have the magazines we publish, the National Healthcare Reform Magazine, the Corporate Wellness Magazine, Self-Funding Magazine, and Voluntary Benefits Magazine, which also is, really behind the success of the event, because we're covering the cutting-edge content of what's going on in the industry, what's coming in the next couple of years in our magazines. And we also are revamping our magazines to add a lot of new guest authors. So if you're someone out there that wants to start writing articles and reaching your peers and colleagues or raising your profile, please feel free to reach out. We'd love for you to have become a guest author and write for one of the magazines, and you'll get your own account where you can just log in, write your article, and post it. Many people don't know, about the reach of our organization. We've grown really, really fast, and we now are the biggest influencer for HR and insurance execs in the country. We reach about 500,000 HR and insurance execs just through our database, our email. Then we have our magazines where we reach a couple 100,000 more. And then we focused heavily years ago on B2B social media and LinkedIn as a way to bring leaders together in the industry to share ideas, collaborate, and also to focus on, really being able to deliver and share cutting-edge news and updates of what's going on in the industry. So we focused heavily our energy on LinkedIn, and that payoff has really, been exciting to see the success of how people use LinkedIn. So we now reach about 300,000 B2B professionals in about 40 different groups that we manage or own on LinkedIn. And just to give you an example of some of the larger groups, if you're not a member, Healthcare Reform has over 28,000 executives. Our health and welfare benefit professionals has over 26,000, and our corporate wellness group has over 19,000. And we're adding about 1,000 to 3,000 new people every week. So we're, it's such a powerful tool, and I really, we really love all our contributors because people really share news. You'll get it a week before you see it on CNN or Fox News, and there's a lot of feedback where people collaborate in the industry. And one interesting thing is we're releasing a survey in about a week, which is our annual social media and insurance survey, and I think it's super important. Because whether you're an HR executive and, you're using social media or LinkedIn to learn or to advance your career, or you're an insurance executive looking to pick up new clients or your service or product, understanding the use of social media, I think, is super important. 83.6% of agents and brokers receive their updates and news from social media, with LinkedIn being the top source. And for that same category, that's 93% for HR, and 65.5% of agents feel they get more timely and updated news from social media, 3 times more than trade magazines. So everybody's using social media, whether it's to get new jobs, get promotion, connect, learn new things, or get new clients. And if you're not active on there, there's so many details of where a lot of people are going wrong, from how they're just entering the information on their profiles, to how they're reaching out and connecting and engaging people, to how they're, what groups they're in and how they're joining it. So it's important to get active on social media. So back to the Employer Healthcare and Benefits Congress. The one thing that's behind our events is it's all 100% about education. There's no sales. When we developed this event, it was based upon, I've been in the insurance industry for 15 years, and I've gone and attended events, I've gone and exhibited at events, and it was based upon, being there and realizing that, people who sponsor get to speak and they're doing sales pitches. The speakers are sometimes the same speakers for the past 5 to 10 years at the event, or the material is just not cutting edge. It's just common sense stuff that you've known. And it's nothing engaging. So we built our conference based upon education, certification, and innovation. So one thing is that, and we'll go into it a little later, is that all our tracks are certification tracks. So you're coming to get trained or certified in a certain specialty, whether it's corporate wellness, self-funding, healthcare reform, voluntary benefits. So you're getting 100% education, no sales. And that has allowed us to really raise the level of thought leadership of the people who come and present, and people knowing that they're going to come and they're going to get, the best knowledge they can get anywhere else in the country. And then on top of that, we focus on innovation. So, for me, a personal passion is, I left working in the insurance industry because I was tired of how it had stagnated. There was no innovation. No one was looking about how to engage employees differently, how to lower costs, what's coming up down the line. And we know that the Affordable Care Act is driving up costs. Agents are struggling. They're getting their commissions cut out. People have tried high deductible plans, consumer-driven plans. They're not having a positive effect on health insurance costs. Americans are becoming more unhealthy. Obesity, diabetes, heart disease is increasing. And, other issues with whether it's voluntary benefits, it's getting more employees to engage in them, to enroll, to understand the benefits, is that there are so many challenges that agents and HR executives are facing. And what our event really is built upon is showing you what's coming down, what do you need to do to succeed and survive in your position, but what are the most cutting edge things that are happening in the marketplace that either some employers or agents are doing that's cutting edge, that's going to transform your position and what you're doing, to what's coming in a couple of years that you need to focus on now that might not even be in the marketplace yet, but it's going to be a game changer for the industry. And then 3, turning everyone who attends the conference into experts through that certification and our speakers, to where you're now above the rest. You've set yourself apart. You're a leader, and that's going to really, whether you're an HR exec, it's going to help with career promotion, the success of your position, or if you're an agent or broker, it's going to result in you adding more clients. So a little bit of a breakdown of our event. About a third of our attendees are HR execs, about a third are agents and brokers, about 16% C-suite, and then the rest, I would say, are insurance companies, TPAs, and vendors. We're we're the first event in the industry to be very transparent about our attendance, where we publish our participant list on our conference website so people can see who's coming. And we're the only event in the country that has networking software where you can look who's coming and pre-schedule one-on-one networking meetings to really maximize your time. One of the things that I think really sets apart our event, and this is important if you're an HR executive or insurance executive on the call, is we have a hosted VIP program, and HR and insurance executives can apply for it. And if you qualify, you'll get a complimentary pass that's $1,000 pass to the conference. And this is because we're trying to really bring in the right people who are leaders in the industry, who are decision makers, to learn, to give ideas, to collaborate, to network. And, we had about 400 buyers last year. We call buyers, that's a typical term on the conference side of it, but that's employers or broker VIPs who came with that free pass, and we're looking to expand it up to about 1,000 for this year. So if you're an employer or you're a broker, if you can go right onto the EHBC website and you can apply for that complimentary pass. And, this is some examples of companies that have gotten, VIP before. Pixar, I'm sure you all love their animated films, Walt Disney, Toshiba, Ericsson. It's a mixture of agents and employers. On the healthcare reform side, we really bring in some amazing speakers. This is our faculty. You might not be able to really read it, but we bring in about 20 speakers. We're going to have about over 200 speakers at this year's event. We're going to have 20 just on the healthcare reform side. And I'm excited at some of our speakers. We have Dr. John Izzo. He's a famous author and speaker. He's one of our top keynotes. It's all about awakening corporate soul and a value shift. I think HR executives are going to love this. This is, how do you create a company of champions? Alan, we're the only event in the industry to get support and participation from the administration. For those of you who went last year, you will see that with the 3 most influential people from the HHS, DOL, and IRS coming to present on healthcare reform, which didn't happen at any other event. And we're going to have that same participation so far. So Alan Shashunsky is in charge of all the fines and compliance from the IRS. He'll be speaking as well as representatives from the HHS and DOL. And we're also trying to get either Barack or Michelle to speak. Michelle's very active on the wellness side, and it definitely helps when you're in D.C. President of the American Medical Association, President of the American Hotel and Lodging Association. We've got some really good presentations from very large employers who've already confirmed. And this is just a little bit of some logos of companies that are speaking this year and have speaked in the past, to see the real type of level of speakers that we get at our event that you don't see elsewhere. We focus on employer case studies at our event, what employers are doing in each of the different tracks of our event. So if it's corporate wellness, what are employers doing in corporate wellness that works and is really successful? And we really like, we get our employers and our members to share what they did that didn't work and how they've changed it. Because if we look at just corporate wellness, for example, the biggest problem is there's no case studies being shared. The Corporate Health and Wellness Association is the only one sharing current case studies. A lot of business associations are referring to case studies from like 10 years ago, which are outdated. And employers have said, listen, we want to know what works and what doesn't work, and no one's sharing that. So that's what we do from the employer side. We get employers to come and talk about what they're doing in voluntary benefits. Last year, I think we had the Denver Broncos director of HR saying what they were doing with voluntary benefits with the Broncos. We do the same thing with self-funding, the same thing with healthcare reform and our other tracks. And it's really cool because, for example, we've had Google present where, no one's allowed to film or record anything that they present, because if they do, the director of benefits literally would get fired because they were willing to share it with our audience and the attendees of our conference, but it was not allowed to be shown outside of our event because they didn't want any of their competitors to find out what they were doing that was so cutting edge in their healthcare and their benefits programs. So that's the kind of cool stuff that you see is, people really sharing what they're doing. And what I love about it all is that these people are very passionate. So there's no other place where you can get these case studies or these things shared, but they want to share it because it's a community, and they want, if they're doing something in voluntary benefits or corporate wellness or self-funding that they found was really successful, they want to share it with other employers. They want to share it with the agents and the brokers. And, they want to see change in the industry. This is the participation from HHS, IRS, and DOL. If you go to our website, you'll see the 7 different tracks, and you'll be able to look at what the topics are and who the speakers are. And this is all built based based upon the associations individually responsible, working with the industry leaders to come up with the topics needed. And you'll also see a new benefit in the middle here on the right is complexity. So we've added complexity to our courses at the conference, so you can say, is this a beginner course, is this an advanced course, or this is an intermediate? So whether you're new to the industry, you've been in the industry a couple of years, or you've been in here 5 to 10 years, you can then search and build out your agenda based upon not only what topic you are coming for, but also the complexity of the actual course. And then we have a lot of workshops, beginning workshops, advanced workshops, and the roundtables. So the 7 different events going on at the conference, we've got the Healthcare Reform Conference, the Self-Funding Conference, Corporate Wellness Conference, Voluntary Benefits. We have the Global Benefits Conference that's sponsored by the Global Benefits Association, which is all for multinational employers and insurers. We have the National Health Insurance Exchange Conference, which focuses on public, private, and state exchanges. We have the Benefits Technology Conference, BenTech. Everything is shifting to how do you communicate and engage employees and employee benefits, no matter what it is. And benefits technology is the future of it, and that's what that is going to cover. And also the Corporate Fitness and Nutrition Conference. So this is a new one. It's all about employers rolling out corporate fitness and nutrition. And then there's a lot of activities you can participate. We have our Day on the Hill, where if you let us know ahead of time who your representative is, we're setting up meetings where with the 4 associations, you can go and meet with your congressman from your local state, and we can really advocate for what changes we want, whether it's under voluntary benefits, healthcare reform, or corporate wellness. It's really getting in front of your legislators. It's a really cool experience. For those of you who haven't even done it, and let's say, what's the fit? Why should I be involved in meeting with a senator or congressman from my state? Is you can share with him your view of anything, of things that should change, but just being there makes a difference, and it's just a lot of fun to do it. I was just doing it last week, meeting with some legislators about a bill that was being passed, and it's just a fun experience, and to be involved in something that you can actually provide input and be influential and learn how Congress really works by meeting with these senators and these House of Representatives. So it's really cool, and you should participate in our Day on the Hill. We also have an HR Development and Leadership Summit, and we have a Benefits Consultant Summit. So it's all leadership-driven. We also have, this year, we're rolling out a marketing conference within our events. For any of you who are marketing professionals, it's going to be a separate track, and it's all on best practices in marketing, and we're literally bringing in about 10 to 15 of the top national leaders in marketing to really talk about whether it's you're doing it through social media or whether you're doing it through conventional means. They're going to all be pretty much New York Times best-selling authors and national speakers. So I'm excited about the marketing because we're doing a webcast in about a week or two, and marketing has gone stale in the employee benefits and the insurance world. Insurance companies are, they're not good at marketing. They're not good at educating. Even a lot of the vendors and service providers don't understand best practices. Carriers and other vendors should be there to help support and educate and be thought leaders to HR and insurance executives, but that's all been lost. And now carriers and others think they're thought leaders, and they're not. They're just pushing out sales stuff, white papers, webcasts, presentations. It's all sales-based. It doesn't help anyone out. They're not differentiating themselves, and they're stuck in the past. I know a lot of them are, their whole thing is, let me go advertise in magazines and stuff like that, like print media is dead. It doesn't really work. So we're doing, besides the marketing event that we're going to be doing within our conference, we're going to do a marketing webcast to try to get some of the carriers and vendors in the industry to kind of wake up and realize things have changed, and you've got to be engaged, and you've got to be a thought leader, and you've got to really help people and listen to people and stop talking over people and making your what you're talking about not stale anymore. Really cool thing for all you ladies out there on the call, Women's Healthcare and Insurance Leadership Summit, inaugural event. First event happened last year. It's happening again this year, the day before the conference. Come to it. It's all amazing national and international women leaders coming talking about how do you advance yourself in this industry, how do you influence policy and make an impact in your organization, how do you move up, and more importantly, it's all about networking and getting to meet some of the other women leaders in the industry. So it's a really cool event. It's the only one in the industry. Definitely recommend you participate in it. Other summits we have, the Employer Direct Contracting Summit, where employers are going to be sitting around talking about how they're networking and contracting directly with hospitals and healthcare providers as a way to better manage their costs. And these are pictures of our, roundtables last year. Really fascinating stuff when, employers are behind the scenes or agents are behind the scenes, just being able to talk, in a very informal setting about what they're doing that's cutting edge, what needs to be changed, and everyone kind of discussing it amongst themselves. This is an example of, it's a smaller shot of the bigger room of the Healthy Foods Roundtable. It's about employers sitting around and talking about what they're doing in the healthy food side. What's cool about these is these private roundtables and forums that we have that you really have to request an invite to come. And otherwise you might not know that they're happening. They become one of the most popular parts of our event. The Healthy Foods Roundtable, the first year was 10 to 15 employers sitting around a table. Year two, it jumped to like 80 to 90 employers. So they're all sharing what they're doing that's innovative, and then there's collaboration, and then, we're pushing out reports and educating what everyone's doing. We have a Chief Marketing Officer Forum. We're launching this year the first annual on-site clinics in the workplace forum, as more employers implement on-site clinics. We have the Medical Directors Summit. One of the things that we have at our conference, I was talking about our certification. I won't go into extreme detail, but this is where, for HR execs or insurance execs that want to be a leader in their industry and take it to a whole nother level, is you can sit in the sessions and they all count towards certification. So at the end of the conference, you can go and take an exam, and if you pass, you can become like a certified healthcare reform specialist. And to be able to say that I learned from the HHS, the IRS, the DOL, and all the top national attorneys in healthcare reform, and this is who taught me, and I got certified. It's powerful, and it's going to make a big difference in your career and how you do business and everything. And a lot of people, haven't taken the initiative to get educated in healthcare reform, and I think that's a big mistake, and you're going to see that impact over the next year. But the final rules and regulations are here, and therefore, you really need to get educated. And you get, I think, up to 10 hours of CE credit for HR professionals, and up to 12 hours of CE credits for insurance agents and brokers at the conference. And then there's a certified voluntary benefits specialist designation you can get at the conference. There's a self-insurance certified specialist, and there's a certified corporate wellness specialist. So you can sit in all the corporate wellness sessions, learn from employers what they're doing, and afterwards take the exam and become certified. I just wanted to show you a little bit of picture of the exhibit hall, because we're changing some things up this year. We've really focused on creating a really cool and exciting vibe and experience in the exhibit hall. Going into an exhibit hall doesn't need to be boring, doesn't need to be something where you're not engaged. We've had a wellness market in the exhibit hall before, where you go in, and if all these companies doing things in wellness, there was little neat things like a company where you bicycle and you're powering a healthy shake, fruit drink. We had gaming companies showing how you can do gaming to engage people in wellness and a bunch of other really neat things. We had a pod company. If you've ever seen those Google pods that Google has where employees can take naps in these little cool high-tech pods, we had them in the exhibit hall. But we're taking that to a whole nother level. We're putting our general session in the exhibit hall this year. And we're also creating multiple different pavilions. So you really can't see it on here, but at the bottom of the screen is the main entrance. And when you come in, there's going to be a wellness market. It's going to have all these interactive wellness vendors and activities that you can learn about. And then when you move in to the next one, we're looking to have like the wellness office of the future. So examples of on-site gyms, wellness offices with treadmill desks and sitting desks and ergonomically chairs. It's going to be really cool. And then the next one is going to be the Consumer Health Hub and wearable tech. So it's going to be everything that that's happening with the wearable technology, the Fitbit, like companies that measuring heart, measuring cholesterol, all these different things. And for those of you who don't know, is the mobile tech is going to be the future of health insurance here in the U.S. So whether you're an HR exec or you're an agent or broker, you 120% want to know everything that's happening on the mobile health and the wearable tech side. And because a lot of the big employers have it in place now, all the big insurance companies are doing it. There was a big partnership with a huge insurance company with one of the biggest tech companies, and everything is going to communicate with employees, whether it's through their cell phones or innovative technology. And also, there's all this tech coming out that's going to be given to employees that have heart issues, diabetes, asthma, any type of conditions that's going to monitor, and it's going to keep people out of the hospital. And that's the key thing that all the employers are going to focus on and all the insurance companies. So by really coming and seeing what's happening with the mobile health and the wearable tech side, you're going to have such a leg up in the future to everyone else. I mean, if you're a broker or an agent, do you want to find out that your client has just told you that Aetna or Cigna has just rolled out this mHealth solution in ways they're communicating with their employees, and you're like, what is that? Or even you're the HR exec, this is coming, you're going to be, what is that? What does that mean? How do I want to allow it? Am I supposed to know about this? Is this all coming? It's already started, and in 2 to 3 years, mobile health and wearable tech will be in every employer in the country. So we're really excited about that side. And then we've got our power session showcase in the back. That's going to have short power topics by top leaders throughout the conference. When the exhibit hall is open, the networking area is in the back for your one-on-one networking meetings. And then we're looking at having a lot of interactive neat activities within the exhibit hall. So we're going to force the exhibitors to do some fun stuff. And we do a lot of giveaways in the exhibit hall, and excited to announce is one of our sponsors is going to give away a lease to a Lexus this year. So along with that, with the other stuff, it's going to be a really fun experience. For those of you who haven't used the networking software at a conference or are new to it, it's one of the most powerful tools. It doesn't matter who you are. You can look at everyone who's coming at the conference and schedule one-on-one networking meetings and really have a focused event. One of our top sponsors last year, I don't know if it's here, it isn't, but they requested 100 meetings and they got 60 of them through the networking software. So if you're an HR exec, it could be looking at, maybe there's a cutting edge vendor, you're looking for a new vendor or broker, or it could be there's a speaker that you want to connect with who's doing a really great case study and you want to meet with them to find out what they're really doing and if they'll share it with you. Kind of on a one-on-one basis, could be for career, job advancement, anything. You can connect with everyone. So it's really a great tool. Here's a quote from Gene from the Dallas County Area School District. It's so well organized that you can't not network. Even if you're shy, there's no way to not network. People are waiting at the exhibit hall just to get in. The food is great, the drinks are great, and the entertainment is great. You just don't want to leave. So can't help but meet people and have a good time. And this is what we're fostering at the event. It's everyone being open-minded. Now, jumping in So one thing is, one of the things we're doing for our sponsors and exhibitors, we have a game changer this year. We're the first, and I think we're going to be the only, is we're going to be doing guaranteed one-on-one networking meetings for exhibitors and sponsors, where we're going to set them up and, providing, up to 1,000 leads during the year for our exhibitors and sponsors to really help them. Because the reality of it, for everyone on this call, if you're an HR exec or a broker, exhibitors and sponsors cover the expense to put on our show. And our show is the most expensive in the industry because we probably bring in about 20 to 30 keynotes, and we fly in a lot of employers from around the country to come speak. And we also, are shooting to bring in about 1,000 HR and insurance execs as hosted buyers. So it's obviously about taking care of them. And this kind of list, it's up to 20 to 30 guaranteed one-on-one networking meetings and up to 1,000 leads during the year. And I don't know why this slide is here. It should really be earlier. When I was going into the qualified VIP program. Why hosted buyers come, HR and insurance execs are coming, to really see what's new and learn the case studies and where the industry is headed. And I encourage you to all look. You can go online and look at who our hosted buyers are. So we also have, let me scoot through a couple of these slides. I already mentioned our continuing education credits and our new conference tracks. I'm going to skip through some of the slides on why exhibit. Some of the, for any of you companies out there that are on the call that are looking to really educate people on what you're doing, if you're an insurance company or service provider, a couple of our top things, that's more thought leadership based is an educational underwriter opportunity. We have a sponsored track at our conference where it's sponsored sessions, but it has to be 100% educational and approved by our speaker committee and the association. But those usually sell all out, and it's a great way. I think we have 2 or 3 left to really get in front of people and have an educational presentation on a very niche topic and share it with everyone at the conference. One of the other things that I recommend outside of just exhibition, because I always like outside the box things, is we organize a lot of private luncheons where you look at who's coming to the conference and identify about 20 to 30 people that, might be your dream clients that you want to meet with. And then we organize and put it all together, and you do a short presentation to your clients and then kind of network with them. And literally what's great is with all our HR and insurance execs who attend the show, 99.9% of them accept and come to these luncheons because they really want to find out about what some companies are doing that's really innovative and how that can affect their bottom line. And I know with what's going on with the Affordable Care Act, it's all about innovation and change, and what you can offer that differentiates yourself from other employers. So that kind of concludes a little bit about our conference. And, if anybody has any questions, feel free. You could type them in the box. We're going to make this webcast available a little bit later. I really didn't go into all the topics that are going to be covered. I don't know if my social media guy has the ability to pull up our website for our speakers to kind of show you who some of our featured keynotes are this year, where you can actually visualize them, and who some of the employers are, because I know that really wasn't on the PowerPoint. But we also didn't go into all the topics of what is, what are we going to cover within each conference. That's on the website, and, I could probably spend an hour or two going over because, we're having 20 speakers just for corporate wellness, about 10 to 20 for the corporate fitness and nutrition. With over 200 speakers, it's tough to kind of go in and say what everyone is going to kind of talk about and cover. But if you'd like, we'd be happy to kind of discuss it with you. We're also rolling out road shows around the country. The road shows are going to start next month in Virginia and roll out to Atlanta and Tampa. So we're going to be doing smaller events to bring people together during the year. And that's going to be surrounding innovation and benefits. We're going to kind of cover everything: corporate wellness, voluntary benefits, healthcare reform. So the one thing that I didn't mention on this webcast, the question came in from Tara, so thank you for Tara. Sometimes it's the little things that are the most important, and that is what is the cost to attend the conference. So if you're a broker, an agent, or an HR executive, you can actually apply to get a free pass to the conference. It doesn't mean you're going to be guaranteed, but you can do that right on the employerhealthcarecongress.com. And then also you can go on there to look at what is the cost to attend. So the cost to attend, it varies based upon when you register, because we have early bird, late bird. So it starts at right now, it looks like I'm looking at here, it's about $695 to register now. And then if you wait in the third quarter, it's going to go up to $899, and in the fourth quarter, it's going to be $1199. So there's early, middle, and late bird. And then if you want to get certified at the conference, certification is $995. But we do run some specials. So if you reach out to us, sometimes we'll have a special going on where it's, if you register for certification in one of the certification courses, that you'll get a complimentary pass to the conference. So you can reach out to us on that by just calling us. It's 561-204-3676, or just go into the website, which is www.employerhealthcarecongress.com. So if any of you have any questions whatsoever regarding the conference, please feel free to, reach out and ask us any questions. We'd love to have you participate. It's really a great event, and it's, you people in the industry that are coming that really make the difference. And I'm kind of ending it here with, two quotes from, two employers. Stephanie Ayala, giving a quote. She was brought in. She's from Petco on the Employer VIP program, and, her saying the Employer VIP program is incredible. They got to attend all the great sessions, but were treated by a VIP. Got to collaborate and network, and so it's really great to see some of the feedback. The HR director of HR for Boar's Head participated last year, and it was great when she came up to me in the hall and said, "This is what events used to be like in the industry," and that she was so excited to be able to jump in from one topic to the next and really become she was very passionate, so it was exciting. Now, Natasha has asked the question, what are exhibitor sponsor rates? It really varies. There are some, smaller branding sponsorships that start at, $2,000, and then exhibit booths start at $3,500, and then there's sponsorships that'll, go, all the way up to sponsoring a cocktail reception, or, sponsoring a luncheon, or something that could be, anywhere of $50,000 or higher. But Megan Chiarella manages sponsorship and exhibition, and her email is megan@employerhealthcarecongress.com, or you can email me and I'll forward it over to you. We're really transparent with who are speakers, who are our attendants, our sponsorship. So any questions that you have, please let us know. If you are an HR exec or insurance exec on the call, please definitely apply for a VIP pass, and I look forward to hopefully seeing you all September 20th through the 24th in Washington, D.C. So I want to thank everyone, and everyone have a great week. Take care.